Joining me now to discuss is emergency medicine physician, Dr. Awais Durrani. Thank you so much for being here to break this down. Given what you know about this ailment, what is your prognosis for his recovery? So many people waiting to hear what's going to happen next.
Yeah, absolutely. Thanks for having me. I would agree that he is in critical condition. When you have a lung infection, whether it's viral or pneumonia in this case, there's a varying spectrum. And so the spectrum goes from not needing oxygen, being treated with outpatient antibiotics, to the extreme end of the spectrum where you need mechanical ventilation and you're on a breathing machine. Thankfully, the Pope is not there. What we do know is he was going through respiratory therapy. And so that means therapists and sometimes using devices to clear up the mucus that has accumulated in your lungs. During that process, he had a bronchial spasm, which basically means that there are small muscles that line the lungs, and those muscles are irritated because of the infection. And so they contracted and spasmed, and that leads to the narrowing of airways and the difficulty of breathing, shortness of breath, those symptoms that he likely experienced. And so now he's on non-invasive ventilation. And so that's that mask that you referred to that goes over the nose, the mouth. It pushes air into the lungs and kind of helps support breathing with high levels of oxygen. And so the hope is that here in the next, half a day to a day, he comes off of that non-mechanical ventilation and can go back to, maybe oxygen around his nose and kind of continue that recovery process.
Right. As we take a look here at the hospital in Vatican City, this is where the Pope is being treated right now. So we're monitoring for any movements there. And at 88 years old, what additional risks does Pope Francis face with this type of health setback? He seems to bounce back. He has a scare, he comes back, but this one sounds pretty serious.
It is serious. And the risk is the longer that you are in a hospital, the higher the chance that you get another infection. And
Right.
so obviously he was admitted for a lung infection, but then you can get numerous other types of infection. In this report, we heard that he had aspiration. And so that's when obviously you are vomiting and some of that vomit goes down the windpipe. That in itself is a very high risk for developing another lung infection. You can sometimes get irritation of the lungs called pneumonitis, but you can also get aspiration pneumonia. And so hopefully, he does not get that, but you can get other types of infections. And then when you're usually in bed for that long, you become very frail and weak. And at 88, that's not anything that's good.
I also wanted to play you some sound to get your take on it. Host of the popular Busted Halo show, Father Dave Dwyer, said this on News Nation. Let's listen.
People are certainly concerned. The Vatican has been guarded in the information they're releasing, although according to most sources, it was Francis himself that insisted that the church be transparent about his medical condition and give frequent updates.
All right, so we do have a lot of transparency here. So could Pope Francis's openness about his health as a world leader have any potential benefits or drawbacks in terms of medical decision making? So many people know what's going on. Is that a good thing?
I think so. Obviously, he's the patient, right? And so it's his right to, release as much or as little information as possible. I think in this case, where so many citizens of the world look up to him, transparency is a good thing. It's also, to be honest, a lot of us have family members that have kind of gone through these situations, or we know what these situations look like. And there is a small degree of solace in knowing what that looks like and what is happening. And when hopefully there is positive news, that's good from a transparency point of view as well.
Well, we're all praying for him and watching this very closely. Emergency medicine physician, Dr. Awais Durrani, thank you so much for your perspective. Really great to have you.
Thanks for having me.
Thank you. Switching gears.